I rise today not just as a member of Congress, but as a healthcare practitioner. Like so many of my fellow healthcare workers, I became an occupational therapist to help people. Before entering public office, I spent over a decade working with seniors and children to help them achieve independent, full lives. Last week, the Trump administration made it harder for our healthcare providers to deliver the services Americans rely on by terminating 10,000 hardworking members of the Department of Health and Human Services workforce. Under this administration, a total of 20,000 HHS employees have been illegally fired, putting Americans at risk every day. These cuts do nothing for the people in Western New York or anywhere else across the country. They're a means of giving tax cuts to the ultra-rich and powerful, those who never have to worry about access to reliable health care. These cuts are more than numbers on a balance sheet. These are lives that hang in the balance. For Western New York, this will make it harder for Roswell Park Comprehensive Cancer Center or the University at Buffalo to advance their life-saving work. These cuts mean delayed treatments, denied cures, stolen hopes from patients battling cancer, Parkinson's, ALS, Alzheimer's, and so many other devastating diseases. I've felt the pain and hope of patients, grandparents, mothers, fathers, and children who are counting on the next clinical breakthrough to survive. These cuts say to them, your health doesn't matter. Your life doesn't matter. President Trump, unelected billionaire Elon Musk, and Secretary Robert Kennedy are more concerned with cutting services and pushing an anti-science agenda than they are with supporting and improving our healthcare system. By walking away from practitioners and patients, the Trump administration is abdicating its duty to our most vulnerable and signaling to the world that the United States is no longer the global leader in scientific research. As someone who spent years treating patients, I know that abandoning our scientists, our research institutions, our doctors and nurses, and worst of all, our patients, puts our entire community and country at risk. I urge this body, Democrats and Republicans, to stand up for our healthcare heroes, invest in breakthroughs that millions of lives are depending on, and restore the funding and workforce our nation's healthcare system depends upon. I yield back.